We would like to acknowledge the Barramadigal people, part of the Darug Nation, their elders past, present and future, as they are the traditional custodians of the land we are meeting on today.
Hi, my name is Heidi, and I'll explain how Aboriginal and Torres Strait Islanders' social determinants of health, specifically genetics, socioeconomic status, and education, and its impact on cardiovascular disease. Caitlin will discuss the links between culture and Aboriginal and Torres Strait Islander health, and Sky will analyse how registered nurses would demonstrate culturally competent care to Aboriginal and Torres Strait Islander people experiencing cardiovascular disease in regional settings with a focus on health promotion.
Aboriginal and Torres Strait Islander people experience unique health issues compared to non-Indigenous Australians. One reason for this is that Aboriginal and Torres Strait Islander physical and mental health is centred around culture, which focuses on their connection to country, social relationships, spiritual well-being, kinship, ancestry, and traditional practices. The Indigenous concept of health and well-being is holistic and encompasses a sense of balance. Therefore, when one or more facets of this concept are not properly maintained, it may create distress and a sense of powerlessness for the individual, their family, and their country. The fact that connection to land directly affects health outcomes is a key factor in improving health and well-being in Aboriginal and Torres Strait Islander peoples. It has been noted that non-Indigenous people who represent government, nurses and other healthcare workers often struggle to understand Aboriginal and Torres Strait Islander concepts of health and well-being and the connection to land and country. This highlights the need for Aboriginal and Torres Strait Islander-led services to be utilised wherever possible and for all services to maintain cultural competence. This diagram outlines how maintaining connection to 7 key cultural domains is vital for Aboriginal and Torres Strait Islander people to achieve and maintain optimal health, which in turn fulfills the social determinants of health. Heidi will now elaborate on the Aboriginal and Torres Strait Islander social determinants of health.
The social determinants of health, as defined by the World Health Organization, identifies an individual's age, occupation, life, birth, and growth as the main social determinants that affect personal health. This is influenced significantly by the flow and concentration of a nation's financial resources. The social determinants of health include an individual's physical environment, characteristics and behaviours, as well as socioeconomic status. This definition is recognised by the Department of Health under the Australian Government and is also one of their goals aimed at improving overall health. There are a number of health issues that can be identified within the Aboriginal and Torres Strait Islander community, which can increase the risk and onset of cardiovascular disease. Cardiovascular diseases can be life-threatening. It is a broad term which focuses on the disease of the heart and blood vessels. Coronary heart disease, also known as ischemic heart disease, cardiomyopathy, heart failure, and stroke are some of the diseases that are inclusive under this umbrella term. In Australia alone, ischemic heart disease is the predominant recurring heart disease. There is a 19.5% diagnosis of vascular disease, heart disease, or stroke in the Aboriginal and Torres Strait Islander people above the age of 55. According to the Australian Institute of Health and Welfare report, Aboriginal and Torres Strait Islander people are genetically 1.5 times at higher risk of death than non-Indigenous people from a cardiovascular disease. This means 280 Indigenous peoples died in a population of every 100,000 people, in comparison to 183 non-Indigenous people. These statistics suggest that Aboriginal and Torres Strait Islander people are more genetically disposed to higher risks of developing cardiovascular diseases. The Heart Foundation, along with the report released by the Australian Institute of Health and Welfare, all further recognised that cardiovascular diseases can be largely preventable. This is due to factors that can be modified in order for the risk of cardiovascular disease development to be actively lowered and potentially eliminated. Factors that can be modified include changing from unhealthy diets to a more balanced and nutritional diet, quitting or minimizing the use of tobacco smoking, increasing the amount of physical activity, along with being aware as to how much alcohol one has consumed in order to avoid excessive alcohol intake. Factors that affect cardiovascular disease, but unfortunately cannot be modified, include age, gender, ethnicity, genetic predisposition, and potentially diabetes. The Department of Health have found links between diabetes and the increased risk of developing cardiovascular disease. In fact, the development of cardiovascular disease is 2 times higher for those who currently have diabetes, 5 times higher for a stroke to occur, and up to 10 times greater for angina to happen in comparison to the population without diabetes. Within the Aboriginal and Torres Strait Islander community, a leading issue is the socio-economic environment that is faced in regional areas. It is evident that education and socio-economic factors go hand in hand because studies have shown that when an individual has lower literacy skills, it is highly likely that they will encounter fewer job opportunities and therefore have poorer health statuses. We are all aware as to how important education is to overcoming disadvantages. In 2016, the Australian Bureau of Statistics reported that from 2011 to 2016, an increase from 37 to 47% of Aboriginal and Torres Strait Islander people between the ages of 20 to 24 had graduated from Year 12. This is in comparison to non-Indigenous people, in which there was a 4% increase from 75 to 79%. Hartmore and Laverty have stated that Indigenous peoples who were 18 to 35 years old and had higher levels of schooling compared to their peers with lesser schooling demonstrated that they were less psychologically distressed, had better self-rated health, and made better lifestyle choices. Therefore, the more education they obtained, they were also able to better understand health literacy. With lower levels of education, it can be extremely difficult in securing a stable job. Unemployment can be seen as one of the triggers that cause Indigenous communities to begin engaging with risky factors, causing deterioration in their health. These risk factors include but are not limited to alcohol abuse, smoking, and stress. In 2016, 41% of Australians were likely to report a household income of $1,000 or more, compared to 20% of Aboriginal and Torres Strait Islander peoples who were half as likely to report the same amount of income per week. In the government report Closing the Gap, it recognises the need for change to better support and provide Indigenous communities with health services. It recognises that health services in local areas need to be easily accessible, culturally appropriate, and most importantly, affordable. To increase affordability, services should not require co-payments or fee-for-service approaches. Co-payment programs can restrict the number of Indigenous patients from accessing much-needed healthcare for the conditions. Currently, the costs for medication to treat cardiovascular disease or its symptoms is subsidised by the Pharmaceutical Benefit Scheme. This is one step forward in allowing Aboriginal and Torres Strait Islander peoples to gain affordable access to much-needed medication. In addition, the Medicare benefit schedule also supports the Indigenous communities by implementing subsidies for the management of disease, inclusive of cardiovascular disease. This is accomplished by allowing 5 subsidised visits to allied health services under the Medicare scheme when they are referred by their general practitioner. Therefore, it is vital that Aboriginal and Torres Strait Islander communities receive education on the prevention of cardiovascular disease. Including Torres Strait Islanders and Aboriginal people, their local knowledge and leadership in medical health programs have been proven to be successful in reducing cardiovascular disease. Sky will now analyse how registered nurses would demonstrate culturally competent care to Aboriginal and Torres Strait Islander people experiencing cardiovascular disease in regional settings with a focus on health promotion.
Cultural competence is defined as a set of congruent behaviours, attitudes and policies that come together in a system, agency or amongst professionals that enables them to work effectively in cross-cultural situations. There are 3 principles of cultural safety. The 3 Ps provide the structure for developing culturally safe professional health practices. The 3 Ps are partnership, participation and protection. As you can see in the slide, we've got a diagram of what the 3 Ps represent. So it's cultural sensitivity, cultural awareness and cultural safety. Cultural safety entails health professionals to undertake a course of personal reflection of their own cultural identity to be able to distinguish the influence that their own culture has upon their healthcare practice. Recognition and respect of cultural and individual differences is a crucial factor in culturally safe practice. We would follow the Nursing and Midwifery Board Australia Code of Conduct for Nurses to ensure nurses are culturally safe and respectful towards Aboriginal and Torres Strait Islander peoples. We must comprehend that only the person and or their family can determine whether the patient's care is culturally safe and respectful. Nurses should be able to demonstrate and acknowledge the social, economic, cultural, historic, and behavioral factors that influencing health, both at the individual, community, and population levels. We must adopt practices that respect diversity, avoid bias, discrimination, and racism, and challenge belief based upon assumption. Support an inclusive environment for the safety and security of the individual and their family, and create a positive, culturally safe work environment through role modeling and supporting the rights, dignity, and safety of others, including people and colleagues. Communication between nurses and other healthcare professionals and Aboriginal and Torres Strait Islander people is complicated by cultural differences and the continuing effects of colonisation. As nurses, we need improved training to meet the needs of Aboriginal and Torres Strait Islander peoples and communities. The process to achieve culturally safety has been described as a stepwise progression from cultural awareness to cultural sensitivity and ultimately to cultural safety. Cultural safety is an educational result that allows safe provision to be defined by the patient. By having effective communication and understanding the language differences that could arise, we would ask the patient if they would like an Aboriginal liaison officer or support worker to come and help with communicating with the Aboriginal and Torres Strait Islander people to help them gain a better understanding of what would be happening if they needed medical assistance.
This presentation demonstrates how understanding the links between culture and Aboriginal and Torres Strait Islander people can directly affect their health. Social determinants of health play a vital role regarding cardiovascular diseases within the Aboriginal and Torres Strait Islander community, as it reveals the inequality they still face today. Cultural safety and cultural competence is imperative to the Indigenous community. To ensure cultural safety is met, only the Indigenous person and/or family member is able to conclude such actions. Due to cultural differences, sometimes in order to communicate effectively with Aboriginal and Torres Strait Islander peoples, the best method to assist them in voicing their needs is by offering them the assistance of an Aboriginal liaison officer or support worker if need be. Thank you.